When assessing the viral markers of the patient, nurse sees anti-hepatitis B envelope appear in the serum. It indicates what? Options are option A chronic hepatitis, option B acute hepatitis, and option C active viral replication, option D stops viral replication. So here the question is, if the nurse gets to see the anti-hepatitis B envelope in the serum, what does it indicate? So the right answer here is, it is the indication of stopping viral replication. So here the right answer is D, option D, stopping viral replication. And the next question here is, which type of viral hepatitis is fatal in the pregnant lady? So the type of viral hepatitis which is fatal in the pregnant lady is, options here given are option A hepatitis A, option B hepatitis B, option C hepatitis C, and option D hepatitis E. So here the answer is option D hepatitis E. So hepatitis E is the viral hepatitis which is very much fatal in the pregnant lady. And next question, which type of stage of malaria doesn't require chloroquine drug? Options are option A erythrocytic, option B gametocytic, option C exoerythrocytic, and option D pre-erythrocytic. So the question is, which type stage of malaria doesn't require chloroquine drug? So in which stage of malaria we don't require chloroquine drug? That is the question. So the right answer here is exoerythrocytic stage. That means after the erythrocytic stage we don't require the chloroquine drug in the malaria. And the next question is, which type of species of plasmodium of malaria have shortest incubation period? Options given are vivax, falciparum, option C malaria, and option D ovale. Let's read the question once again. Which type of species of plasmodium malaria have shortest incubation period? So which has the shortest incubation period of the plasmodium? So option answer is falciparum. Falciparum has the shortest incubation period. And the fifth question is, dengue disease is transmitted by, options given are A arbovirus, option B Aedes aegypti, option C Anopheles mosquito, and option D Wucheria. So the right answer here is B. We all are very aware of it. So dengue is caused by Aedes mosquito. So the full name of dengue is Aedes aegypti. Which type of defense mechanism destroyed by human immunodeficiency virus? So the question is, which type of defense mechanism which is destroyed by human immunodeficiency virus, that means HIV virus, is, it is options given are option A humoral, option B active, option C passive immunity, and option D is cellular immunity. So the right answer here is D cellular immunity. Cellular immunity is destroyed by HIV virus. So when a patient is affected with a HIV, the cellular immunity in the body is destroyed. And the next question is, CD8 cell count in HIV infection is, option A 500, option B 400, and option C 200, and option D is 50. So here the right answer is 400. CD8 cell count is in the HIV infection patient is 400, and whereas coming to CD4 cells it will be 200. Mostly the students will be confused in this question, CD8 and CD4. CD8 cells are 400 and CD4 cells are 200. So then only it is a very confirmatory diagnosis for confirming the patient with AIDS. So the next question here is, which vaccine not comes under NIS? So National Immunization Schedule. NIS stands for National Immunization Schedule, and here the option given are BCG, option B diphtheria, option C MMR, and option D is OPV. So option C is the right answer. MMR does not come under NIS. NIS is National Immunization Schedule. MMR does not cover under the NIS. And the next question, which type of immunity should be acquired by immunization? Option A active, option B passive natural, option C active artificial, and option D active natural. So when we are giving immunization to a person, what type of immunity is acquired to a particular person? So the right answer is active artificial. So immunization comes under active artificial immunization, so the person will get active artificial immunization. Such an easy question. So we have already made a video regarding this immunization in our previous video, so please try to check it out. I'm gonna add the link above. So and the next question here is, which type of immunoglobulin occur in hypersensitivity reaction? Option A IgG, option B IgE, option C IgD, and option D IgM. So when a person is having hypersensitivity reaction, what type of immunoglobulin occurs in the bloodstream? So the right option is option B IgE. IgE immunoglobulin is related to hypersensitivity. And the next question, how much population covered by a PHC at hilly area? At hilly area, PHC covers and how much of population? Option A 5,000, option B 30,000, option C 20,000, and option D 80,000. So the right answer is 20,000. PHC covers 20,000 of population in the hilly area. Next question, how many sub-center covered by primary health center? Options are option A 4, option B 6, option C 8, and option D is 24. So the right answer is 6. So 6 sub-centers are covered by single primary health center. One PHC covers 6 sub-centers. Next one, community health center comes under which level of care? Options given are option A primordial, option B primary, option C secondary, and option D is tertiary. So the right answer is secondary. Community health center CHC comes under the secondary level of care. The first level of care is village and it is PHC, and the second one is CHC community health center, and the third tertiary is one referral hospital and education hospitals. Next question, which type of waste are generated in hospital in abundant amount? Options are option A biomedical waste, option B chemical waste, option C general waste, and option D is radioactive waste. So right answer here is option C general waste. Hospital generates general waste in abundant amount. Recycling waste should be collected in which type of bag? Option A yellow, option B black, option C red, and option D white. So the right answer is C, red. Recyclable waste should be collected in red bin. And next question is, which type of color coding give highest priority according to triage system? So options given are option A green, option B red, option C yellow, and option D is black. So type of color coding which gives the highest priority according to triage system is red color. When a person is red color tagged, it means he is in an emergency situation. And the next question is, which type of vitamin deficiency occur in disaster? And here the options are option A vitamin E, option B vitamin D, and option C vitamin A, and option D is vitamin K. The right answer here is vitamin A is the deficiency which occurs during the times of disaster. The concept of primary healthcare is given at option A WHO, option B UNICEF, option C Almata, and option D UNDP. So the right answer is Almata. Here the primary healthcare concept is given by Almata. Principle of primary healthcare are accept option A community participation, option B equitable, and option C health education, and option D is multi-sectorial approach. So the principles of PHC are all of the following except one thing. So health education is not the principle of the primary health care, except health education, rest everything, community participation, equitable distribution, and multi-sectorial approach, all these are the principles of the PHC. And next one, in which stage of disease signs and symptoms grow fastly and reach maximum level? Option A incubation period, option B prodromal period, option C fastigium, and option D convalescence period. So here the right answer is C fastigium. So in the period of fastigium, the symptoms and signs will grow faster and reach to the maximum level. And here incubation period is in which the virus gets incubated, and so the fastigium period in which the virus replicates and the signs and symptoms will be appearing in the severe stages. Immunization comes under which level of prevention? So the options are option A primordial, option B primary, and option C is secondary, option D is tertiary. So the right answer will be option B primary. Immunization comes under primary prevention. And next question is, how many antenatal visits according to WHO? So according to WHO, there are how many antenatal visits? Options are option A 3, option B 6, option C 4, and option D 8. So the right answer is C, that means 4. Total of 4 antenatal visits should be done by a pregnant mother. This is given by WHO. And The next coming question is, which type of vitamin should be used in prevention of congenital neural tube defects? So the options given are option A B1, option B B6, option C B9, and option D is B12. So the right answer here is B9. B9 is the vitamin which prevents the congenital neural defects. So the right answer is B9, option C. The next question is, what is the level of IQ in moderate type? So we have 3 levels of IQ, right? So the right answer here is 35 to 50 is the moderate type of moderate level of IQ. And next question, which dose should be given by a nurse in sensitivity test? So options are option A 1 ml, option B 0.5 ml, option C 0.1 ml, and option D is 0.05 ml. So the right answer is 0.1 ml. A nurse administers 0.1 ml of the medication to check the sensitivity of the drug towards the patient. So the right answer is 0.1 ml. Here it is option C. And next coming question, all vaccines are live except, so here the given all the vaccines are live except the one vaccine. So which is the one which is not live vaccine? So we have to find out. Options given are BCG, option B rubella, option C rabies, and option D is rota. So the right answer here is rabies. Except rabies, all the other vaccines given are live vaccines. And next one is, which type of vaccine provide passive immunity? Option given are option A live, option B killed, option C toxoid, and option D none of these. So the right answer here is option C toxoid. Toxoid provides the passive immunity. So look at this, friends. We till now we got 3 questions in the immunity. So immunity is a very important topic. So please do check out our video regarding this. And the next question is, when a child comes at immunization schedule, how much dose should be given of vitamin A? So when a child is brought to hospital for the immunization schedule, what is the dose of vitamin A which is to be given for the patient, to the child? So there are options given are 5 lakhs unit, international unit, 1 lakh international unit, option C 2 lakhs international unit, and option D is 2.5 lakhs international unit. The right answer is 1 lakh international unit is to be given for the child of the drug vitamin A. And next question is, vaccine preserve how much days? So how many days we can preserve the vaccines? The options given here are option A 120 days, option B 30 days, option C 90 days, and option D 48 to 72 hours. So the right option is 90 days. Once a vaccine is open, we can preserve it for 90 days. And next question is, what is the temperature of Indian cold chain? So cold chain, you all are aware it, I guess. So the right answer is 2 to 8 degrees. So the answer here in the options is option B. 2 to 8 degrees is the right answer. 2 to 8 degrees of the temperature is used for maintaining the vaccines. Cold chain is nothing but storage of vaccines. So for that we need 2 to 8 degrees. All the vaccines in India we prefer to be stored at 2 to 8 degrees of centigrade. Next question. White death is other name of which disease? Options are option A leprosy, option B tuberculosis, option C AIDS, and option D is cholera. So the other name of white disease is the options given. The right answer in the options is tuberculosis. Tuberculosis is also called as white death. The next question is shingles is caused by. Options are option A variola major, option B CMV is cytomegalovirus, and option C varicella zoster, option D is toxoplasmosis. The right answer is varicella zoster. Shingles is caused by varicella zoster. Next question. UNICEF provide all except. Option A child nutrition, option B child immunization, option C child health education, and option D family planning. So UNICEF provides all child education, child immunization, child health education, but it does not provide family planning. So UNICEF is something related to children. So here the options we can guess it easily. So everything here given is related to children except the family planning. So the family planning is the wrong option here. So UNICEF provides all the three: child nutrition, immunization, and health education, but not family planning. So the right answer here is family planning. And the next question is match the following health agencies and the location of their headquarters. So here the options given are WHO, 1 Rome, option B UNICEF, 2 New York, option C FAO, 3 Geneva. So as we all know that WHO, the headquarters of WHO are in Geneva. So A for 3, and next one is B. UNICEF is for New York, and headquarters of UNICEF are in the New York, and FAO are in the Rome. So here the right answer is B. A for 3, B 2, and C for 1. The headquarters of WHO are in Geneva, UNICEF in New York, and FAO in Rome. Next question. 3-tier system of healthcare delivery system in rural area in India is based on the recommendation of which committee? Options given are A. Boer Committee, B. Chadda Committee, C. Srivastava Committee, and option D. Mudalidhar Committee. So here the right answer is Srivastava Committee. 3-tier system of healthcare delivery system in rural area is based on which committee? So it is based on the Srivastava Committee. And next question. In disaster management, all are true except option A mitigation before a disaster, option B response in a pre-disaster phase, option C yellow color pre-disaster phase, option C yellow color for high priority, option D gastroenteritis is commonest infection after disaster. So in the disaster management, all the given options are true except one. So what is that answer? Here response in the pre-disaster phase is the wrong option. Mitigation before a disaster, yellow color priority, and next one gastroenteritis, all these are the common, but the response in pre-disaster is the wrong option. So here it is the right one. And next question is 3 Ds means in hospital waste management is. So when we are talking about hospital waste management, 3 Ds means what? Option A is disinfection, disposal, drainage, option B discard, disinfection, drainage, option C destruction, deep burial, drainage, and option D destruction, deep burial, and disposal. So here the right answer is disinfection, disposal and drainage. 3 Ds in the hospital waste management stands for: 1 for disinfection, 2 for disposal and 3D for drainage. So the right answer is option A. Biomedical waste mixing with cement is known as what? Option A incineration, option B inertiation, and option C is shredding, option D is autoclave. So the right answer is inertiation. Inertiation is mixing the waste with cement. Next one, which of the following is occupational lung disease but not pneumoconiasis? So here the right answer is brucellosis. So the options given are brucellosis, silicosis, anthracosis and cellulosis. So brucellosis is an occupational lung disease, but it does not come under pneumoconiosis. So silicosis, anthracosis and cellulosis all are coming under the pneumoconiasis except the brucellosis. So here the right option is brucellosis, option A. The next question is maternal mortality ratio is calculated by. So we have a formula for calculating maternal mortality ratio. So just remind the formula here, and the options they asked are: option A maternal death divided by live birth, option B maternal death divided by 1000 live births, option C maternal death divided by 1 lakh live birth, and option D maternal death divided by 1 lakh population. So here right answer is maternal death divided by 1 lakh's live birth. And next question, among the following best indicator of health in a community is: option A maternal mortality, option B infant mortality, option C life expectancy, and option D neonatal mortality. So which is the best indicator of health in a community? Infant mortality. When we check the infant mortality rates, then only we will get to know the community's health status. So it is the very best indicator of health in the community, infant mortality. And next question, most common cause of maternal death in India. So the options are: option A anemia, option B hemorrhage, option C sepsis, and option D is obstructed labor. So postpartum hemorrhage is the most common cause of maternal death. So as asked in the options, hemorrhage is the right answer. So hemorrhage is the common cause for maternal deaths. And next one is, birth in India must be registered within: option A 7 days, option B 14 days, option C 21 days, and option D 28 days. The right answer is 21 days. Before 21 days we need to register a childbirth in India.